Hello and welcome to Two Peds in a Pod, the paediatric medical education podcast. Remember, you can hear our entire back catalogue of episodes on iTunes, Spotify, Google Podcasts, Amazon Music, and of course, our SoundCloud. So please tell your colleagues and friends and hit that subscribe button. I hope you enjoy today's episode.
Hello and welcome to another episode of Two Peds in a Pod, the podcast on medical education topics relating to paediatrics, helping us look after our children, young people, and of course the families of our patients. It's Ashley Rees here, consultant paediatrician and medical educator. I work in Hertfordshire and I'm in the chair for this episode where we're going back to the basics and thinking about the very nourishment that keeps our paediatric patients sustained and nourished from very early in their life and beyond, and that is milk. So this episode is all about baby formula. We're going to discuss where formula came from. We're going to think about different types of formula, and if you happen to pop into your local supermarket, you'll see many different types of formula on the shelves that can be very bamboozling for new parents wanting to know what to feed their new baby. As well as very many prescribable formulas, so-called specialist formulae, in the British National Formulae for Children. So to help me navigate this area, I'm delighted to be joined by Rahi van der Boer, who is a paediatric dietitian. She spent many years working at Great Ormond Street and is the spokesperson for the British Dietetic Association. Rahi, thank you so much for joining me.
Thank you so much for having me.
Before we start, I think it's important that we say we've got no declaration of interest in current employment. None of us are paid by milk companies, but we have been involved in educational activities, some of which were sponsored by baby milk companies. So I think it's fair to declare that. And the rules around infant formula companies sponsoring education events have changed fairly recently. So we both uphold to those principles through our relevant organisations. So the other important disclaimer I think we need to start with, of course, Rahi, is that breast is best. And while I thought it was very useful to go back to basics and talk about baby formula and the milk that we feed babies, actually the first conversation and the most important conversation is encouraging mothers to breastfeed their babies where at all possible.
Absolutely. And it's easy. It's there's lots and lots of clinic and groups, especially online groups now, also facilitated by NCT. It's a lot easier to get started now than it was many years ago. I think when you felt isolated and you didn't have a lot of support, we are much more open and supportive of women breastfeeding in public as well. So I think things have changed about how we feel about breastfeeding in general. So it's exciting times to be becoming a new parent today, thinking about breastfeeding.
And NCT, you mentioned, is the National Childbirth Trust. And this is a group who run parent craft classes for new parents or maybe parents who are not first-time parents but want to meet other families having a baby at the same time. And there's a lot of emphasis and support before birth to try and support the breastfeeding conversation and to make sure that breastfeeding is the most important interaction that new mum and new baby have to try and sort of support the nutrition.
Absolutely. I mean, I say it's easy, but even though I've been a paediatric dietitian for many years, it was only when I became a mum myself, I realized, oh my goodness, this isn't as easy as it looks on TV, where they make it seem like you just pop the baby on the breast and off you go. It isn't. It is a learned behavior for both mum and baby. But when you do take a little bit of time and, being able to go to some of these courses or just, observing other parents, there is a lot to learn. And it's a wonderful experience that once you master, there's a lot of joy and benefits, health benefits for both mother and baby for years to come.
So I guess just thinking with my paediatric sort of hat on, we see babies coming through emergency referred by our midwife and health visitor colleagues who are not feeding very well or not feeding at all, and they need some support and input to the feeding. And sometimes in those situations, babies' weight isn't quite what it should be, and feeding just hasn't been going the way that it should. Breastfeeding hasn't been going the way that it should, and the baby isn't getting the milk. And one of the great things is trying to facilitate that situation and making it better with the help of, certainly on my paediatric ward, my nursing colleagues, certainly the nursery nurses who look after babies on the ward, and my midwifery and neonatal nursing colleagues that will be involved, and help. And if it takes a couple of days to get baby latched on and for mum and baby to understand exactly what's happening, if the baby, say, has come in a bit dehydrated and with some weight loss in those first few days, that can be really, really enlightening for everybody, and really gratifying to support the breastfeeding and get the baby feeding again, get weight on, get maybe the electrolytes have been a bit abnormal, and get nutrition going again and get the support going in the community once the baby's discharged.
Absolutely. I think, had you asked me a few years ago, I would have said, yes, we've got to get that feeding in. So we need to get formula in, whatever it takes to get baby feeding. And don't get me wrong, we need our babies fed. We need that nutrition to go in. But sometimes just taking a step back and perhaps just thinking, why is baby not feeding well? Sometimes it could just be down to the fact that baby isn't latching on well. Now, obviously, if they have a tongue tie, that needs to be addressed. But other times, especially if you're a first-time mother, it's probably just helping mum learn to get baby to latch. And that takes a little bit of practice. So if in the interim, baby does get a little bit of formula because mum hasn't got any express breast milk, that's fine. I think in the short term, we've got to be sensible. We need our babies fed, and it might just help save breastfeeding in the long run. So we can come across as very anti-formula, but sometimes we just need to use it for our advantage whilst remaining very positive about breastfeeding and, letting parents just, reduce that anxiety that they have initially. They're thinking, oh my goodness, my baby isn't gaining any weight and so on. And there's a lot of pressure on healthcare professionals to get that baby feeding. So it's fine to use that formula in the short term, but don't forget to perhaps think, perhaps with a few tweaks to mum's positioning of baby at the latch and things like that, you can rescue breastfeeding.
That's a really important start for our discussion as we move on and talk about the baby milks, because the baby milks are out there, and in fact, feeding baby with artificial, if that's the right word, formula was given an interesting name based on the fact that babies were nursed, as in breastfed, but not by their own mother sometimes. I think that was called wet nursing, wasn't it, or wet feeding?
Yes, very interesting. Apparently, babies back in the day were fed from cow, was it? Goat? Donkey? We had a few different that we came across.
So eventually wet nursing fell out of favour, and attention turned to looking for a substitute for breast milk. And so, yes, feeding human babies milk from animals was called dry nursing, and that flourished in the 19th century. And yes, many different animals, goats, cows, mares, donkeys, were used. But why is it cow's milk has been the one that seems to have sort of stood the test of time in that way?
Perhaps it was a little bit closer in terms of some of the other ingredients, perhaps easier to make in large quantities, since Formulae is very, very popular.
Okay, good. All right. And I believe donkey's milk was thought to be healthier because its appearance more closely resembled breast milk. But I think that was well before all the work done on constituents of these milks. And it would seem that there were ingenious arrangements in order to try and get the milk from the animal into the child, including, according to one report, milk spoon-fed to an infant or given via a cow's horn fitted with chamois at the small end as a nipple, for example. But obviously, bottles then became available during the Industrial Revolution years, different shapes and sizes, and so getting towards the late 1800s now, and attempts were made to try and find a breast milk substitute.
We do have lots and lots of different types of breast milk substitutes, should I say, of infant formula. We are spoiled for choice. And there's such a big variety now too, with all the different hungry milks, goodnight milks. I mean, they do change names, so it's very difficult to keep up with everything that's out there.
So, I mean, I was in the supermarket the other day and I counted 15 different types of milk, either brands or different types. As you say, there seem to be milks for a hungry baby, milks for a baby that's hungry on a Monday, for babies who green on a Wednesday, milks for babies that sleep well, babies that don't sleep so well, babies that wake up at 3 a.m. There are lots of different types of milk out there. And why is it, do you think, there's evolved this massive array of different choices for parents that I know they find bamboozling? And we talked about this before as well, that what milk do they choose for their baby? Why would they go for this milk over that milk? And what is it that makes this milk right for this baby?
In all honesty, the variety of these follow-on type milks are really available because they can be advertised. And infant formula or stage 1 that's targeted towards babies under 6 months of age cannot be advertised because we know that breast is best, and babies who do breastfeed are much less likely to experience diarrhea, reduced risk of respiratory infections, improved cognitive function scores and things like that. So these variety of creative milks is one way of advertising infant formula, I suppose, but it can make it very confusing for parents. And certainly if their baby has been refusing a variety of different feeds or hasn't been feeding really well, perhaps because of just a mild reflux, and then mum or dad has found a formula that they have liked, but then the baby doesn't seem to be feeding well again, then they know they can go out and get another one. So it's just, it is a shame that there's just so many, because it just actually, I think it makes the problem worse because we have too many to choose from. And I think when you have too much choice, that just makes it very difficult and makes it very confusing for parents. I don't know what you think.
No, very much so. I agree. And around about the 1900s, the turn of that century, the amount of babies that were not breastfed was high, and there was a lot of morbidity and mortality within those babies. And we looked at some data from the 1970s that was quite alarming in the effects that bottle-fed babies were very much more likely to have infections and more mortality in that group.
Yes, in the 1970s, there were, what did we read? A formula-fed baby was 40 times more likely to die from diarrhea and 20 times from just general mortality, I think, from memory. We need to have a look at the stats again. But that is really frightening data to look at. And sometimes we just don't talk enough about the benefits on breast milk. And I think sometimes we need to just be more positive in general. We can be very anti formula, and I think that has the opposite effect. Sometimes it just makes it seem more desirable when you're, it's a bit like cake. You can't have your cake, and then the kid just wants more cake or more dessert. Whereas when you're really positive about breastfeeding and just giving and making the tools to allow more parents to breastfeed and more easily, then I'm sure we will see our breastfeeding rates go up in the UK. Hopefully it has gone up during lockdown. It'll be nice to see what the rates are. I'd be really genuinely interested to know. And again, I think we do need to take into fact that we have more women working, yay, which is brilliant. And sometimes the woman might be the higher earner. And so, she might be going back to work after 6 months, 3 months, whatever. So rather than giving the message, we don't want any, formula, perhaps if the formula is going to help bridge the gap between the time when she's at work and she's not able to pump, but then she is carrying on with some breastfeeding, maybe in the morning and the night, then that's still a really, really positive change where we're being more open about mixed breastfeeding, or mixed feeding, should I say, where you're allowing some breastfeeding and some formula without any, without being negative about it, really. I mean, we want to see more parents breastfeeding. There's no doubt about that, and we need to understand better why is that. And I think formula is being marketed as the more easy option, but something that parents don't realize is actually it's much easier to breastfeed than it is to get up in the middle of the night and make a bottle of formula. It actually takes much, much longer. Whereas if you're breastfeeding, you can just pick up baby and literally pop them on your breast and go back to sleep. But there is a little bit of work involved. And if you're a first-time mum, you might just not know what to do, especially if you haven't seen anyone breastfeeding around you. And as I alluded to earlier, it is a learned behavior, a learned skill for both mum and baby. So it is worth that initial investment in time, but we need more lactation consultants on the wards. We need more nurses trained with how to support, women to breastfeed, not give in to formula as easily, unless, of course, we don't want to put our babies at risk. We do want them to feed. To be, a fed baby is best. But yes, I mean, in a sense, there are more health benefits if your baby is exclusively breastfed than receiving formula.
And that's a really interesting point you make there about this relationship between the mother and the baby, and maybe breastfeeding. Mothers need to eat well and keep the fluids up and keep themselves, in good health as well. And so I think that's an interesting point about the dynamic and balance, of parents, of couples with their babies, whether they're same-sex couples. There are roles to play here, even when one of the partners is doing the breastfeeding.
Yes, and for those women who are prepared to pump, then that can, the express breast milk can go into a bottle, and then the second parent can then feed baby so that mum gets a little bit extra sleep. I'm sure that's probably what she's after in those early days, just that little bit extra 20 minutes of sleep or so. So yes, there's a nice way of sharing the burden of feeding by expressing.
And of course, one of the things we should counsel against is co-sleeping, isn't it? Because that's is a risk factor for sudden unexplained death in infancy, and co-sleeping is a risk, gives a risk of suffocation. So there's got to be if you're advising parents about breastfeeding and keeping babies fed in the middle of the night, it's always worth just checking in that they've got a bassinet or a cot at the side of the bed, and the baby does not stay in the bed. And that would be a good reason for the partner to at least be a bit awake and rousable, and maybe deliver the baby to the breastfeeding partner, and make sure the baby gets back in their own environment, back to sleep on their back, feet to foot, and all of that. And change the nappy, of course. So we've talked about all the different milks out there, and I guess the reason for the issue around first formula and marketing is that there is an international code of marketing of breast milk substitutes, which is an international health policy adopted by the World Health Assembly of the World Health Organization, and that was described in 1981, and it restricted advertising of infant formula, basically. So infant formula in that form cannot be marketed, and many countries have signed up to it, well over 80, I believe, and there are more joining that. However, the code doesn't necessarily, I believe, have any power itself, but it is a standard that, as I say, many countries have signed up to, and it is very much to promote breastfeeding and prevent milk marketing. And by milk marketing, there are things like they cannot claim health benefits of formula. Milk companies cannot give free samples to women who are able to breastfeed, and those sorts of things. And there's also the baby-friendly hospital initiative, which I know many hospitals have signed up to and are accredited to be, which allow them to say very loudly and proudly that they're encouraging breastfeeding and do not allow bottle or formula milk to be given out, distributed to new mothers in their unit.
Absolutely, but I think these things are really, of course, very, very important. But equally, as I mentioned earlier, in practice, we just need more experienced staff who can actively support breastfeeding. We really need that. And I think that is key to helping increase our breastfeeding rates in the UK. Yes, we shouldn't be promoting and advertising infant formula. But having said that, if we then don't have the resources and the key staff to help promote breastfeeding, then we're sort of letting down our mums in a way as well. So lots to think about there as well, I think.
So just moving back to something we talked about earlier, we've said that there were many different mammals, milks that were used to feed babies, artificial feeding, not breastfeeding anyway. And some of those mammals so there are some manufacturers that make those mammalian milks in a tin, in a powdered form, that you can use if you think that that's something that you would want. I guess goat's milk is one of those that I know is available. And there are some families that think that is better than the normal, usual for infant formula is cow's milk, but there's no good evidence that is any better or any more beneficial for a baby than a cow's milk formula, is there?
Not that I'm aware of. I mean, I understand that the sheep and the goat might be more likely to be grass-fed and perhaps their diet is a little bit better. But at the end of the day, if there was a choice, it really doesn't matter if you're going to choose infant formula. They're all virtually very, very similar. But again, if you can, try to breastfeed if you can. Yes.
And those other milks that we've mentioned, the milks for a hungrier baby, the sleep well baby, the comforts, some of the comfort milks are again the follow-on milks. If you look at the NHS .uk website, there is a section on infant formula. I think it's a really useful, gives a really useful rundown of all those formulae that are available, and you know it's clear from the information there that there is not really any great evidence that the hungrier babies or the goodnight milks, for example, have any great evidence behind them that they are going to make a baby settle more or settle better. I know that there's a ratio of casein and whey that is altered to try and make it more easily digestible, or even less easily digestible, i.e. to hang around in the stomach for a bit longer. So the hungrier baby formulas contain more casein than whey, and casein is a bit harder to digest. So it's thought that the hungrier babies would behave in a less hungry way if they had more milk in their tummy for longer. But again, I'm not aware that there's any great research evidence that supports that.
No, and we shouldn't be recommending these different. I think it can just confuse parents more. If anything, if parents are saying to you, I can you please recommend something else because my baby is hungry, chances are they actually just need a bit of a nutrition dietetic review just to see what's going on in there. Perhaps it's about just changing the volumes of the feeds, and in some babies who just need help with weight gain, you can concentrate the feeds and things like that. So there are other things that you can recommend apart from those. And from memory, some of the goodnight milks and things like that do have slightly more protein, so 1.6 grams per 100 mils compared to the usual 1.3. But just as a quick reminder, many years ago, most infant formula did have up to 1.6, even 2.1 grams protein per 100 mils. But then there was evidence to show that babies who had too much protein were more likely to gain weight more quickly than what was appropriate in terms of weight for height, weight for length. So the protein content in our infant formula was actually reduced to match breast milk. So another sign that perhaps these goodnight milks are not really necessary.
And just getting into, so my clinical area is looking after children with allergic conditions. So I see a lot of babies who have potential milk allergy, and babies who also have reflux. So maybe the comfort milks and the reflux milks, there seems to be a little bit more sort of substance behind them. Comfort milks may be partially hydrolyzed. The hydrolyzation is this breaking down of milk proteins into smaller chains, if you like, and you get extensively hydrolyzed, that are the so-called hypoallergenic milks that are prescribed for our babies that may have cow's milk protein allergy of a non-IgE or an IgE type. And then the reflux milks, a number of those contain things like carob bean, that is a carbohydrate that thickens up when you mix it with water. So it's a thicker milk that goes down, and some actually thicken up when they hit the acid of the stomach. So you need to know which one you're on. I mean, antacids in gastroesophageal reflux in infants is going out of vogue. So, but it would be inappropriate to have a baby on an antacid and using one of the anti-reflux formulae that congeal and thicken up when they hit the acid of the stomach.
I mean, I guess as a first line, it's okay for parents to give that a go. But there is good evidence to also show that, positioning of the baby, keeping them upright after they've been fed, can be just as effective in managing some mild reflux. So some positing after feeding is perfectly normal as well. So it's important to reassure parents about that. And most babies will grow out of reflux by the time they reach 1 year of age. So it is something to just sort of ride through in a way. And I guess the most important tip is to make sure that maybe their bed is slightly elevated if they do experience some mild reflux. But we don't recommend partially hydrolyzed feeds for the treatment of cow's milk protein allergy. So if you suspect cow's milk protein allergy, then it should be, extensively hydrolyzed formula in the first instance.
And if mum is breastfeeding and there's thought to be non-IgE or delayed cow's milk protein allergy, then to take dairy out of the diet. But the important thing here is to do this as a trial, 4 to 6 weeks. And I would direct everybody to the IMAP guidelines, the International Milk Allergy in Primary Care guideline that is hosted on the Allergy UK website. Very clear guidelines. Deals with the issue of an IgE-mediated, histamine-mediated allergic milk reaction, and that's the immediate reaction, and then this non-IgE or delayed cow's milk protein allergy. These babies are reported to be more fussy, more irritated, more agitated, more uncomfortable around feeding. They may well have reflux symptoms, pulling their knees up, and vomiting, and we could do a whole podcast on reflux, of course, but treatment of reflux is becoming much more explanatory and supportive. Babies are gaining weight. Is the baby actually bothered by it? And I guess what was interesting is the EAT study, a byproduct of the EAT study was assessment of symptoms of young babies to try and work out whether these symptoms were actually allergy symptoms or not. And many of the behaviours that we describe in babies that is put down to possibly being milk allergy were reported in that cohort who were normal and did not have milk allergy. So that was an interesting outcome of that study. Again, it's about reintroducing dairy after a period of dairy-free, whether it's mum who's breastfeeding taking dairy out of her diet, or whether it's going on to a specialist hypoallergenic formula, then that should be done for a finite amount of time, and then the cow's milk should be reintroduced either to mother's diet or to the baby to see if those symptoms come back. I think that's really important because there are significant cohorts of babies that seem more settled 4 or 6 weeks down the line after that period on the hypoallergenic formula.
Yes, and I mean, certainly from my experience, lots of parents can be reluctant to reintroduce to sort of confirm the diagnosis. But it's so important, and as long as they feel supported, most parents are really willing to do that. And it can just highlight that perhaps those original symptoms, as you've said, wasn't actually allergy. So it is important to do that reintroduction, and grade if the baby's formula fed, then grade it in so that it's a nice, easy transition for both mum and baby.
I think it's probably reasonable now to just talk briefly about the more serious milk allergy children that we look after, whether it's immediate allergy, who have to generally be completely cow's milk protein free if they had an immediate reaction to milk, maybe on the first exposure of milk in food, say when they have been breast fed, so first porridge maybe or for something like that. But also the babies with delayed cow's milk protein allergy that aren't settling, that have some obvious symptoms according to the guidelines of milk allergy, don't settle on the extensively hydrolyzed formula. There's another version of hypoallergenic formula, an amino acid formula that we use in that situation.
Yes, I mean, most babies are absolutely fine on the extensively hydrolyzed formula. I very rarely have had to change a baby who just for, say, cow's milk protein allergy, even if it is delayed cow's milk protein allergy, I've very rarely had to change them over to an amino acid formula. I know it's very controversial, but I am quite pro-probiotics. I know lots of other professionals may feel that the evidence just isn't there. But sometimes just adding in a probiotic can also help settle baby symptoms. I guess it really depends on what baby symptoms are. There are some infant formulas with probiotics added, but that can make it a little bit tricky for parents to make. That's how I feel, if I'm honest, because it also needs to be made once the water has been cooled right down. So there's a bit of fluffing around waiting for that. So if parents are in a hurry and they, just make it with water that's just been cooled down for 20 minutes, it would still be too hot and would kill off all the probiotics in the infant formula. So that's another strategy that can be tried if the baby just isn't settling. But also just remembering, I'm not trying to put down first-time mummies at all, but sometimes, if baby is crying a little bit throughout the day, they might just need a cuddle, they might just need you, and they will settle. So, and if they do wake up a few times in the night, that is perfectly normal. I know I feel terrible saying this, but I think we do live in a culture where there's just false expectations that babies should be sleeping through the night by 3 months. I mean, if only. I think my kids didn't sleep through the night till about age 3 years. So, if the babies are waking up a little bit in the night and crying a little bit, that's perfectly okay.
So there's the FAN, the fan that I learnt as a more junior paediatric doctor. If the baby's awake and do they need a feed? Do they need attention? Or do they need their nappy changing? And if it's the middle of the night and they don't need a feed or a nappy, then at that time they probably don't need attention either. So certainly when babies get a bit older, probably from 4+, certainly 6+ months, it's about self-soothing at night, and that will help. But I'm also noticing that many babies who are reported to maybe have cow's milk protein allergy are reported to wake a lot at night and be upset and unsettled at night. And if they truly had a delayed cow's milk protein allergy, that should be pervasive. It should be all the time that they're unsettled, and feeding itself should upset them. So I sometimes factor that in as a marker of saying, well, actually, I'm not convinced this baby has that delayed cow's milk protein allergy.
Having a discussion about the expectations of, if baby is crying a little bit more in the night, perhaps they just need, perhaps they do have a little bit of reflux as well. So they should be, left a little bit upright after a feed. And just those, those little tips to just help them can be really helpful, because when your baby is crying for for a long time at night, it can be really distressing for parents. So, but certainly if the baby has growth failure, or so that's when their weight centile has crossed more than 2 lines on the growth chart, or if they also have severe eczema, then yes, an amino acid formula would definitely be appropriate rather than an extensively hydrolyzed formula.
Very good. Yes, and a trial again to see if the skin gets better, I guess, in eczema. One of the other milks we haven't mentioned yet that is recommended only from 6 months is soya formula made from soya beans. So this is plant-based, but there are some concerns that soya contains phytoestrogens, the chemical structure of which is similar to female hormones, and there are concerns that this may affect particularly male babies. And these formulas also contain more glucose, as I understand it, so may harm babies developing teeth if they've come through. So not usually recommended. And of course, many babies with cow's milk protein allergy also have some cross reaction with soya too. But you mentioned there the next issue that I think it's worth covering, and that's those babies that aren't growing or gaining weight, and those babies that may need a higher energy formula, because there are a number of high energy formulas out there that we can use. What are your thoughts about those, and what's your experience of using those in babies who maybe aren't growing very well?
Probably a bit old-fashioned. I tend to concentrate the milks, and I give parents special recipes so that they know, you might add an extra scoop. But obviously, it's not quite that way. It is all nicely scientifically calculated out. But we concentrated the recipe, and that also thickens up the milk, so that can help manage some symptoms. But it'll also help with the children's weight gain. There are, I believe, some new milks that are ready to feed, perhaps with. I imagine they're a lot more expensive, so depending on the home situation, you'll have to weigh out whether it is worthwhile prescribing that or asking your dietitian to calculate out a more concentrated recipe. Sometimes it's just a small, just gradually every week, increasing the calories up a little bit, concentrating it up, by 1% every week might be enough. And initially, I always find that in the first month, they don't put out any weight. And you think, why are they gaining the weight up? Put up there, and then suddenly after 30 days they start to gain weight because all of that good work with the concentrated feed, every mum's got into the swing of getting those recipes in. So I guess it depends on the degree of weight loss and how quickly you need that weight gain to go. And so lots to consider, but they definitely will be convenient, the ready to feeds. But concentrating the baby formula will be fine. And it means for parents who do travel around, that makes it very easy for them to store it in a suitcase as well, now that we can travel.
So you mentioned getting your dietitian on board, and I think that's a fantastic possibly way to sort of try and wrap up, because you're right. My dietitian colleagues are very expert in manipulating the normal formula, because of course when you make up formula, each brand comes with its own scoop that's its own size, and that scoop helps you make the milk up 1 scoop to 1 ounce in imperial.
You need to know the dilution, absolutely, so you get the recipe.
So that's really, really important. You can't just borrow a scoop from another brand and use that. And I think that's probably something that a lot of people don't know. I guess the other thing just to deal with at this point is the volume that we expect babies to feed, which is this magic 150 mils per kilo per day, maybe up to 180. And if they're having 200 and you calculate that that's the volume that they're having, they're probably being overfed in the first sort of, up to 4 months of life, let's say. But parents don't talk in those terms. They say, I give my baby, I make up 4 ounces and they take 3 ounces and I feed them every 3 hours. And I think for us as paediatricians, we have to, be quite good at that bit on countdown where you're doing a lot of maths and calculations to work out what it is. So you need to know there's roughly 30 mils in an ounce to be able to work out the number of mils in the ounces that are being given, how much is being taken, and how often in a 24-hour period gives you the number of feeds a day. And then you can work out the actual volume in mils the child is getting, divide that by the weight, the current weight, or in the first sort of few days of life, the birth weight. And there you have your mils per kilo per day. You can work out that magic number. Many parents now keep track of their baby's feeds on their phone, mainly in the notes section, but there are apps as well. And that can be really, really helpful. The other thing as well that I've noticed is some babies need help of our speech and language colleagues sometimes to help with their latching and oromotor skills sometimes. So I think the triumvirate of a paediatrician to make sure that there's nothing else or nothing serious going on, dietitian to support the type of feeds and maybe concentration volume of feeds, and a speech and language therapist to help with the actual mechanics of feeding can be a really successful trio to help if babies are reported to be somewhat bottle or feed averse.
Absolutely. And don't forget the number of feeds in the night. As soon as he said, oh, my baby's fed 3 hourly, don't forget to ask, but what about at night? Exactly when does baby get up to feed in the night? Oh, it's not 3 hourly anymore. It's different. So let's try and increase the bottle sizes during the day. It's just lots of manipulating of bottles and volumes and all that fun stuff.
And you're absolutely right. Some of the toddlers that remain on bottled formula or that are given cow's milk in a bottle. So, we've been talking a lot about formula, but actually cow's milk itself. We transition babies at around 12 months onto cow's milk. Why is it that we leave it till 12 months and 1 minute and at 11 months and 3 weeks and 2 days, it was deemed inappropriate to give them actual cow's milk?
Because I haven't got any evidence to say that at 11 months and 29 days, baby is safe.
And I know that there are families and people who will give their babies cow's milk, supermarket bought, used to be doorstep delivered. Some of it may still be a bit earlier, and certainly mix it in food a bit earlier. And that's okay, isn't it?
Yes, absolutely.
But the older toddlers that are being given cow's milk to drink are what I refer to sometimes as milkaholics, and they drink so much milk they don't actually eat anything, and they're reported to be very fussy eaters and picky eaters and don't eat very much. They're gaining weight because the milk is high in energy, and one thing they do lack is iron, and many of these children with this sort of scenario come in with an iron deficiency, sometimes quite severe. So the question to ask, exactly as you said earlier, is how many bottles does a child have during the day? And the answer will be, only has 2 or 3, but then they may be having 2 or 3 during the night, and that was you didn't ask that, so you didn't get told it.
Exactly. And they may also be experiencing constipation because they're not getting enough of those fiber-rich foods. 1 in 3 children suffer from constipation. It's an untapped area because we're not talking enough about fiber in our children and exactly how much they need. So, yes, we do want the babies to start drinking from an open cup from about 6 months of age. And, we can get them to have maximum 300 mils of cow's milk from the age of 1. Tricky at first, but it can be gradually weaned down, definitely. And I'm sure once they start enjoying food, they'll be happy to give up that milk.
Well, Bahi, thank you so much for the conversation today. I've really enjoyed taking a tour of infant formula, and we worked our way through from very early in a baby's life right the way up to toddler. So it's been really interesting. Thank you so much for joining us.
Thank you so much for having me. It's been a pleasure.
Thanks for taking the time to download our podcast this week. If you enjoy our podcasts, please tell your friends and colleagues and subscribe to us on Spotify, iTunes, Google Podcasts, Amazon Music, and of course, our SoundCloud. Thanks for listening.